Can anybody hear me?
They won't be able to. Oh, they won't be able to. No, it's an audio listening.
Oh, you can raise your hand. Or
I'm going to go see personal phone.
You guys, just so you know, we're still trying to get the presenter, which is Cindy, the broker, on the line, so just bear with us for a minute.
Hi, this is Cindy. Can you hear me now?
okay, yep, Cindy, we can hear you now. Let me just share your our screen with you. You can just hold on 1 second. Okay, Cindy, I'm going to actually have you dial in as an organizer because I have you in as an attendee, and I can't share the screen with you unless you're an organizer. So do you have the call-in information as an organizer?
I think I have a call-in information as an attendee.
Okay, we're going to email you the information to call in as an organizer, and then I'll be able to share the screen with you. So if you want to just hang up, and we'll email the information to you ASAP.
You got it. Hi, everybody. This is Cindy. Can you hear me?
Cindy, we can hear you, but everybody else won't be able to respond to you.
Okay. So does that mean that I can start with this?
We're just getting a little feedback here. Sorry. We can try. Do you? I just don't know how you can control this without logging in as a.
You know what? I can't. Can I just tell you to move forward, and we'll just work on this together, and then we'll figure it out for the next one?
Yep, that sounds good. Just let me know when to click.
Yeah, I'd say click and let's move on. Sorry, everybody, for the technical difficulties in switching platforms on this open enrollment. So if you can go to the next slide, we're going to go through the slide presentation that we sent. There are some changes, and I'll go through the changes and the whys behind them. So this was a lineup of all the benefits that are being offered, and we'll go through all your questions. I think they'll open up the mics at the end. I don't know if that's how you do it, or do you email them and read them back, the questions?
However you would like to do that, we can.
I'd like to open up the phones to let them have good dialogue. I think that works best. So we'll do that at the end. So if you can go to slide 3. All of the benefits are eligible now at a 30-hour per week, 90 days, except anybody who had been grandfathered in, meaning they had got employment offer letters or anything in December. We took you on as open enrollment coming January 1. Otherwise, it's 90-day eligibility, 30 hours per week, and always we carry over the dependents up to age 26. If you can go to slide 4. Any new hire coming in after the 90 days always has 31 days to get all of your eligibility on without having any late enrollment information. And what that means is if you go after the 31 days, you would be subject to full underwriting and could be pre-X because we missed that timely add-on. You will always have a qualifying event for any of the birth, marriage, divorce, loss, change in spouse's employment. And I want to make it very clear for all in Terra coming onto the merger plan design, this is actually a qualifying event for you. So if you had enrolled in a spouse's program and this became a better option for you, you can actually change that election yet all the way up for the qualifying event of the merger. If you can go to slide 5. This is a hard one to read, and I know Jackie had forwarded this out to everybody with all of the applications, and I'm going to explain to you why it's different. We had gotten all of our medical, I'm going to say, rates, plan designs, everything from United Healthcare, working with them on Interra's current benefit renewal, and Healics is also on United Healthcare plan. And for weeks, going back and forth with them, asking for underwriting's blessing of the rates they gave us as being good rates. They said they thought they'd be fine, but they wanted the underwriter to review it. It was taking quite a bit of time. We sent out our numbers. At the time we did, we felt we were in good order, and they came back at the 11th hour, giving us a 38% renewal rating, not new business. So unfortunately, we could not absorb that kind of change without changing something. The owners really wanted to keep the math that we laid out on what the individual participants were paying, had a lot of reasonings behind it in the whole package, and we'll go through those piece by piece. So we kept that premium identical, but changed some of the plan designs. The plan design that was originally, the first one on the left side was a PPO, and that came out as a $1,000 deductible, $2,000 deductible, now is an HMO, $2,000, $4,000. The out-of-pocket maximums are in line, worst case scenario, but we still had to change the plan design a bit for the rate increase that came through with the merger renewal. The difference of an HMO to a PPO is you need to be a primary resident of Wisconsin or Illinois to qualify for it. There is no out-of-network benefit. However, United Healthcare is such a large network, along with every single doctor, hospital that you're currently using in your metropolitan areas, Mayo Clinic, everything is absolutely still in the network. It is not the old-fashioned style of HMO that means it's a gatekeeper and you have to call your primary care doctor to get a referral to go to any specialist. That is not how this HMO is designed. It is designed to have you pick any specialist for any reason of what it is you're trying to get care for in network, and you can go. We always educate everybody to make sure anytime you're making an appointment, I do the same thing because I'm on an HMO. I always ask prior to making my appointment, are you still in network with my HMO, United Healthcare? Keep in mind that if it's a life-threatening situation, and I give two examples, I had a individual 60 miles away from network, felt like they were having a heart attack, went in network, or did not go in network, was out of network, because it was life-threatening, even after it was diagnosed as indigestion, really eating too much pizza. It was paid in network because the participant really felt like they were having a heart attack. Another example was traveling abroad. Individual didn't feel good. Just went in, thought that it was altitude sickness and needed some, just some more IVs from dehydration. Ended up being rushed into a hospital to have a temporary pacemaker put in and then rushed to a different hospital 3 hours away to have a permanent pacemaker put in. Everything got paid in network because it was life-threatening. That's the real difference of a PPO to an HMO. You guys are coming off of both health savings account options, so this is kind of a newer design from what you had, but we really felt compelled to offer a plan design that allowed individuals to manage healthcare who is on a lot of prescriptions. And the difference there is on a health savings account, the way the IRS, the government set them up, is you have to satisfy your large deductible first before you can use the co-payments on prescriptions. Here on the HMO, your prescription co-payment starts right away, then it's paid at 100% after that. And if you go in for office visits, a routine or specialist office visit, those visits are paid at a co-payment, not the deductible. That's how they differ a bit from what you currently have. In comparison with your $2,000, $4,000 health savings account, the biggest difference there is you did not have what was called an embedded deductible, and I want to explain that. Both of these plan designs are embedded deductible, not the way that you're currently coming off of. In English, what that means is anybody who has more than one person on the plan, for a single, your single deductible is just plainly a single deductible. For anybody who has more than one person on the plan, you're going to see what's called a family deductible. So you had a $2,000, $4,000. But one person, if you had a surgery, let's use a $10,000 surgery, that one person can satisfy that $4,000, not stop at the $2,000. Both of these designs stop at the individual deductible in addition. We didn't want to pass on the risk of keeping the rates lower by allowing one person to blow through and hit the family out of pocket. And that is really becoming a creative way of controlling premiums, is by not having that stop on the additional people who are enrolled in a family unit. That's the main difference on your current plan design that has the 2,000, 4,000. We now have that 2,000, 4,000 deductible as an HMO, not an HSA. We also did offer an HSA. Unfortunately, on the one that we originally rolled out, we ended up having to change that deductible from $3,500 to $5,000, keeping the premiums as low as we did, because we came out with lowering the premiums for everybody because we allow a lot of other benefits from a tax strategy, having you pay for your long-term disability, and the reasons why behind it is that going on claim, that benefit then is all tax-free, where right now that's not how it's designed for you, and somebody who actually would be on claim would have almost 40% of their income. When it shows that at 60, you still have to pay taxes on it. So the math worked out very well that you weren't paying more than what you had, and we were trying to give you a lot of cost savings to manage that difference. And for those of us who don't have a lot of claims, we wanted you to put the rest of that money in your health savings account accrual bucket, which allowed you to keep building that, because that's not a snooze you lose. You get to roll that forever and ever. So being able to put money into that by keeping our premiums lower allowed you to start building. Worst case scenario, you had claims this year, it would be there for you. Best case scenario, we try to have people who don't have to use that because they're healthy, then that's there for them when a big claim would hit. Or two, some people will continue to use cash flow to pay for medical out-of-pockets and leave this continue to build to manage your health when you're in retirement. Because now this bucket becomes a tax-free way of managing health care, because as we age, that is a big cost in our retirement. So we wanted you to have that option too. The out-of-pocket worst-case scenario on the health savings account, the way we originally designed it, we kept that exactly the same. So even though we did increase the deductible, your out-of-pocket still is at a maximum of $6,350. And that has that embedded stop where it will absolutely have only one person can hit that. And currently yours are not embedded, so one person could actually hit the $12,700. That's the big overview of the health care. You will have enrollment kits that came out of all of the applications, and we'll go through when we open up on the phone. But the United Healthcare, everybody has to fill out that application, whether you're taking it or not. And it outlines exactly in Part A, we just need your individual information. If you're waiving off, you have to put in the F of that United Healthcare application that you're waiving off, who you're waiving off, initial, sign that, and then the signature line in G, everybody has to sign. If you're enrolling, we need you to have that form filled out too. If it's just you, the employee, then you fill out A, C, which would check the box employee only. You would then indicate, are you going to go on the HSA or are you going to go on the HMO? We have to know which plan. Only coordination of benefits comes in if anybody's on Medicare, and then you would just sign and date. If there's more than just you on the plan, Section B would carry all of your dependents or spouse/partner that is to be covered on this plan. The tricky part on United Healthcare in Section C is the way they select the boxes. There's 3 of them. There's for the employee, you check that. If you're adding on just an adult spouse or partner, then you check the employee and the box spouse partner. If you're having just you and children, you check the box of employee and the box of dependents. If you're having full family, meaning 2 adults plus child or children, you have to check all 3 boxes. You can now move on to slide 6. This is your per pay period dollar amount that you will pay for either the high deductible plan, which is the HSO, or the HMO plan. It comes out every 2 weeks, except for in March and August, you get paid 3 pay periods, and we only take them out of 2. This is the gross amount, so keep in mind what you'll see net on your paycheck will be less due to the fact of whatever your tax bracket is. So if somebody's in an all-in 20% tax bracket, it would be 20% lower than that. So that's your gross amount that we show everybody, and everything comes out pre-tax yet. If you can move to slide 7. Here's where we have 2 options where you can put money aside to pay for out-of-pocket. A health savings account is only available if you take the health savings account option. I know you guys currently have a health savings account option. You can either roll that into the task program, and Pam will have the enrollment forms and the rollover forms for everybody. You can leave your dollar value with your current health savings account program. That is a requirement, but I always advise people, historically, as soon as that account is not an active account, I've seen them go up to $5 a month administrative fees that they tap onto those. So you want to check that out. Health savings accounts are used for anything that you want to put in there, and it'll go on a pre-tax basis. And if you can go to slide 8, it'll show you the amounts you can put in. This allows you the amount of a single was $3,150, and now for 2018, it went to $3,450. If you're a family, it was $6,500, and now it's $6,900. You did with Intera, they put in $250 a year to anybody who signed up onto their health savings account. That is being removed, and we added all of the benefits together, and we felt it to be a greater value of giving you the richer 401k match, which we'll go through on the slideshow yet today. Next slide talks about the flexible spending account. So the health savings account is available for you to use for medical on the HSA. Flexible spending account is used for you on your medical on your HMO. The flexible spending account has a cap of $2,650 that you can put in, but it is a snooze you lose, meaning you must use that by the end of the year, or it gets put back into a zero balance. HSA continues to roll, FSA does not. Dependent care is also in the flexible spending and is up to $5,000. I like to explain the difference of how the math works is on the HSA, the amounts you have in there. If you go for reimbursement, it's only what's in the bucket that you can have for a reimbursement of a bill. A flexible spending account, the reason it's a snooze you lose is because if you put in $100 a month, you would have $1,200 for that year on record to be put into this flexible spending account. If you went in and had a surgical operation that was $4,000, they would then give you, in January you had that surgery, you would apply for your flexible spending, and because you put in 100, that's not what you get in flex spending account. You would actually get the $1,200 right away in January. Even if you leave a company, that is not reimbursable back to the employer. That's why the flexible spending is a no rollover, because of the liability on the company both ways. The dependent care works like an HSA in the flexible spending, meaning you have to have your money in there prior to getting it on a pre-tax basis for your daycare. So if I had put in that I was doing $100 a month, I would only get a reimbursement of $100 a month. That's how flexible spending works compared to health savings accounts. If you can go to the next slide, we're going to talk about dental. All right. We have dental insurance with Delta Dental. The plan designs, you guys had 3 different plan designs to choose from. We took one, the one that was in the middle kind of what everybody had, and have a $50 per person deductible, $150 per family, $1,000 annual benefit. Your cleanings, your exams, x-rays, 2 times a year. So I tell everybody, go every 6 months. It's really important. And that's at 100%, no deductible. Your basic services, fillings, all of those type of things are at 80%. And your major crowns, bridges are at 50%. You do have orthodontic for children under age 19 at 50% up to a total coverage of $1,500 a lifetime. Your cost is biweekly. Here, we are in only a 2-tier spread where yours was a 4-tier, and that spread out a lot more cost to the employee child, employee spouse, and employee family the way it was designed with the 4. So we brought it down to the 2-tier. Your employee only is identical to what you are currently paying of the 9. And the employee spouse, employee children, and family is $19.26 per pay period, which was a lot less than what you were currently absorbing on your current plan design. Next slide would be our vision. Vision, we have always vision, and the biggest reason we have them as our carrier is the Walmart, Sam Clubs are your big brand name facilities with deep discounts, so you get a lot better deals. Most importantly, they're the one vendor that allows a person who does not sign up now at open enrollment, say next year you want to add vision, you actually will be able to do so. Most carriers, once we waive off of open enrollment, don't allow us to add on anybody ever again. And I find that very difficult because as we age, we really need to have the opportunity of covering you for vision. So the next slide, 12, will go through and gives you the outline of the vision. If you can go to slide 12. This will give you what your co-payments are bifocals, trifocals, standard lenses, frames, contacts, everything that we have outlined. And the next slide will give you what is your cost to participate in that. Here on the vision and on the dental, you'll see that all of the classes, your premiums went down significantly except for the single on the dental, was to allow you to have extra money along with the medical lower premium, but we kind of wanted you to use that in your flex or your HSA to cover the ability for the better disability tax-free. So you go, this is also pre-tax, these are gross numbers, so bi-weekly it'll be less than that depending upon which tax bracket you are in. If you go to the next slide, we have disability, life, and voluntary life. This is for all hourly people, and then we have salaried people. I am not sure, to be honest with you, if we have a lot of hourly people at Intera or how many are salaried. So I'm going to go through both plan designs because I don't want to leave anybody out just because I'm not clear who's in what category. Anybody who is hourly, they will have $50,000 guaranteed life insurance, so up from $20,000 that you currently have to $50,000. That is paid for by the company. You will have short-term disability that is paid for by the company of 60% of your weekly salary, up to $500 a week. That benefit has a 14-day injury, 14-day sickness, and it covers you up till a full 90 days has been passed. Once that 90 days is passed, then you have what is long-term disability. Long-term disability is a different plan design where it's allowed for you to choose it. I think it's important because without our paychecks, we don't have cars, homes, we just don't have a lifestyle. But if you pay for it, you get that benefit tax-free. And we sent out everybody their personal enrollment forms, and it makes a huge difference on who pays the premium via who gets to have to pay taxes and who doesn't. Long-term disability, typically when somebody goes on claims, they're on the claim for the rest of their lives. Something happened that you no longer can work to what you are programmed as far as school, trained, and currently earning. Most people will have a disability that is not their own occupation. This is your own occupation. It will keep you in this type of earning capability for 2 years for hourly. After that, we should be able to qualify for Social Security, has about a 2-year waiting period, and we know how to help you through that maneuvering. In addition, you have voluntary life insurance that you can get extra life insurance. You have the $50,000 on yourself. You can go up to another $80,000 on yourself with no underwriting. So no matter what your health is, you can get an extra $80,000 at open enrollment. If you don't want to do the whole $80,000, if you took $10,000 of voluntary, you can then go up to that $80,000 every open enrollment without going through underwriting. If we don't open it up at all, then you're going to be subject to underwriting as a late enrollee anytime after this open enrollment. You have the ability to put up to $500,000, but it can only be 5 times your annual salary. That's where it will cap. Spouses, you have the ability to go up to 100% of the employee amount. So whatever you have on yourself, you can do that same amount on your spouse. Their guaranteed issue is at $15,000. So if you want more than that, there's some underwriting questions that would have to be asked. Children are up to $10,000 and $10,000 guaranteed issued. These programs are portable. So should you leave the company, your life, your current life that the company pays for and your voluntary is portable to go with you. Those are all designed by price by income and age, and that's all in your personal applications. So everybody will have to, for sure, sign I don't want either the long-term disability or I do want it, and who is your beneficiary going to be on the life, and who is, if you want voluntary, who is that to be on, and who would that beneficiary be? If you go to slide 15, this is for the salaried employees. Everything is identical except for the short-term disability is 60% of salary up to $1,500 a week, and the 60% of monthly salary on the long-term disability is $10,000, where the other one was $6,000. This own occupation goes for 2 years, and then it goes to anything suitable as far as what you're currently trained for of occupational and income for the rest of your life up till age Social Security full benefit. We can't put an age in there because it depends upon when you were born. Some people are full benefit between age 65 and 67. The long-term disability for salaried and for hourly people would all then be tax-free. So that monthly number that you see on your personal application is how much money you would truly get, take to the bank, no taxes owed on that. Okay. Next is slide 16. And this is on top of your current benefit offering through Allstate. They have voluntary additional benefits, and this was emailed to you where you can get additional accident insurance, critical illness insurance, or cancer insurance. And I know they give discounts on their pricing if you have all three of them taken. There's some brochures that were sent out on it. I'm not the broker on it, so I defer you to Pam to go through in depth on those, but that is also available for you to pick and choose some of those. You don't have to enroll in these. These enrollment forms aren't going to be required to come back. The ones that we need to have are the United Healthcare. Everybody has to send back on the medical, either you're taking it or you're not. The dental, we'd like to know that you're taking it. If you're not taking it, I don't need an enrollment back. Vision, if you're taking it, I need to have the application. If I don't get one, we're assuming you're not taking it. The disability, your private packets need to have the waiver either signed you're not taking long-term disability or you are taking it, and beneficiary designation information is needed. So we have on file, if something would happen to you, exactly where should that benefit go, because that's not the time you want to find out you don't have a beneficiary designation, and then it goes into a probate situation. All right, next slide. This slide 17 is on the 401k. The 401k with the company, the owners really wanted to give you this option. You have to be 3 months of service working. So anybody who has worked for Intera as of October 1st, that's your 3 months, and you would have 250 hours. You would then get to participate in the 401k plan. We offer both the traditional 401k, which means you put your money all in prior to paying taxes. All that money grows. When you take it out, you pay taxes on everything. And you have the right to have a Roth option. That means that you pay taxes on your deposit only. The growth of that account grows, and you will never pay taxes on the growth. Reasons I educate people that the Roth is a very cool option are two. One, if somebody wants to retire prior to age 65 and being able to get on Medicare, I only know healthcare rules the way they are today, and we follow them all the time, but I want people to have the privilege to be able to get on the Affordable Healthcare Exchange, and you can actually get healthcare and pay zero premiums. Here's an example. I have a 62 and a 61-year-old. They retired. I watch what the exchange requirements are. The requirements are now, if somebody's on $64,000 of income or more, they have to pay fully for their health care premiums. So I took $62,000 out of their IRA's 401k. They're living on $70,000. I took the other $8,000 out of their Roth. They have their $70,000. Yet I pay zero in premium for them to be on health savings account offering just like you have, but they don't have to pay anything for premium because I know the rules and the math. If I had them at $64,000 or more taking out of their IRA or their 401k for their income, they would pay $2,900 a month in premium. So if you don't have any Roth option to pull from, to maneuver around in retirement, I don't know what the rules are going to be. I do know they'll probably change, but you got to have them. I think it's easier to pay for taxes while you're earning income than when you're on a guaranteed flat income. The last part that many of us are not aware of, so I like to empower you with knowledge, is that Social Security, when we're on it, has the same formula. They'll look at all the other income that we pull, and we are either determined to pay no taxes on our Social Security, 50% taxes on our Social Security, or 85%. That's a lot of taxation if I have Roth money and it can stay under one of those thresholds. It saves you a lot more money. So those are the whys behind why the Roth is there. The Healics plan is a safe harbor, which allows anybody to put in fully what the IRS limits are. So if you're under age 50, it's $18,500. And if you're over age 50, it's $24,500 for 2018. There's no top-heavy testing. There's no highly comp mandates that will require you to put in less. So you can do the full amount up to the IRS every year. The plan highlights are, for me, the biggest benefit for all of you is the dollar for dollar match up to 3% of your salary, 50% match up to the next 2% of salary. So if you put in 5, the company puts in 4. The match is made per pay period, and we are going to be sending out timelines because we want everybody to be enrolled by December 22nd. So if you want to be live for January 5th payroll to start getting that match, we got to have you up and running for payroll to be able to execute. We emailed out to everybody all the fund lineups. We have 2 sets of lineups. One is that you can personally pick, design, choose, and we do that with you too, right over the phone, figuring out what's best for you. Or 2, we have what's called the destination funds, where it's designated with full-blown money managers to manage these accounts in the risk class that you want. Historically, a full-blown managed account cost more money. We had negotiated with the money managers that those are actually cheaper than the individual accounts. So the pooled money manager accounts have good returns, but you're just authorizing more of a hands-off. You want somebody to manage that on your behalf. And we'll walk you through all of that and set out emails of getting everybody scheduled to get you enrolled. This will be a merger of plans. And what that means is your plan will just automatically roll into this plan once we're done with all the testings, closing downs of the plans, everything. I'm going to guess that we probably can't get all of the 5500s and everything done on the Intera plans until probably about middle of February or to the end of February. So the plan assets themselves will not come over into your accounts till probably about March. So anybody who wants access to that money would need to deal with if there's a loan that you need to have or something, you're going to have to do it before the end of the year. That's the only part that's not going to hook back up because I got to wait until the testing is all done. Once it comes back into the plan, say it's March 15th, I'm giving that as probably the latest it will ever come. It will come back into the plan and be fully vested, available to you as far as having that access to your account for loans. The vesting in our match schedule is it's 100% yours. If the company has extraordinary profits and we add in more, that will come into a vesting schedule of 6 years to become 100% vested from the date of employment, from hire date. The next one is just questions. So if you can open up the phones, we'll go to live questions. I hear stuff. Do you have any questions?
Yeah, I've just opened it up, so almost everyone in a moment will have ability to have mic access, so I will let you know when that is available. For those of you who actually dialed in through the computer, there's a possibility that you may not be able to, so otherwise you can always add into the chat and we'll be able to add that in. But if you guys are not going to be saying anything, I would recommend muting your phones because there will be a lot of feedback.
Anybody have any questions?
How do you figure out the...
Yeah, Tom has just said, how does this work with co-insurance?
Depends on which plan that somebody is on for co-insurance. They're both 80%, and you'll see that they both out-of-pocket maximums are the same. So a single would have $2,000 deductible on the HMO, then you're going to pay 20% because the insurance company will pay 80%. Will cap out at $6,350. That's how the HMO goes. On the HSA, your deductible is $5,000, and you pay 20% because insurance pays 80%, and your total out-of-pocket maximum is $6,350. At $6,350, out-of-pocket maximum includes the deductible and your portion of co-insurance. Any other questions?
Is there an option for not rolling over our current 401k into the new plan?
No, it's a merger plan. Great question. Everything is a full merge of plan. So the assets come over. Somebody can individually take it out. If they are no longer employed is when you can have an option of what it is you're going to do.
What do you have for Roth IRA? I do. I do have the Roth IRA, and the reason being is once you take, like, if you take how much they're going to take out at one time, it's going to be so much.
Hey guys, if you have a question, definitely make sure to speak clearly. Otherwise, if you're having side conversations, make sure your phone's on mute.
That I want to make sure is it's a timeline of trying to get all of this stuff back. And I know we're under the wire. We missed being able to get online with doing enrollments. So it's all paper. If we can get all of that paper back by the end of this week, we still need to get it all uploaded to the vendors and back, that you'll have your ID cards and everything in hand. With that said, I encourage people, if you're on a lot of medications, to try to manage your medication in this transition. So in December, middle of December, even last week of December, go and get your January scripts filled so that there's no hiccup in somebody running out of medication and needing to get it filled during the holidays. Might not have hooked in. I'm not saying it won't. Our goal is to absolutely get it done. But if it doesn't, I want you to have medications. If somebody says, well, your 30 days isn't allowed to re-up until January 13th, I always tell them, I'm traveling. I'm gone. I'm going to be, out of the country. I always get my prescriptions filled, no questions asked. Any other questions?
Cindy, this is Pam.
Hi, Pam.
So the easiest way for this paper enrollment to get back all of the signed paperwork would be to fax all of them to me here at the Milwaukee office. And I can give everybody the fax number. We want it to be secured unless you have encrypted ability on your end to send it to me, that's fine, but faxing it also is the best way. So the number for my fax is 414-375-1639.
Hey, Pam, once you receive those faxes over, will you be sending out an email or some sort of confirmation to that employee letting them know that you did receive it so that it doesn't, kind of get lost in the paper shuffle?
Actually, we have a nice system on our payroll through Paychecks now. Once we get everything loaded in, we can print out a summary and then I can actually email that to everybody so that they know there's confirmation. And then, if there's something that maybe they thought they had sent for the vision and it isn't on there, then we can confirm that as well.
So for the Intera employees that are not currently on Paychecks, will that still be the same? Will you be adding that individual into Paychecks?
Yes, ma'am. Yes, we had a data dump done and we're just waiting for all of that. That's another reason why the online wasn't done. It was just a little bit of a snafu with their software, but we should have everything loaded in there. And then once again, that summary will come through and it's real nice. And it just shows if you've signed up for it, enrolled, or you've declined. So, yep.
Thank you for the clarification.
Sure.
And that will show for every employee for every line of benefit.
Yes, yes.
Yeah, no, that, it's just, I don't know if you know that. I do, Sure. Can I ask a question, please?
Yes.
Just to clarify, where in our emails is the paperwork in our emails that we're supposed to send in to you for the 401k and for the health insurance?
The health insurance along with the dental and the vision, Always Care, was sent out in the big packet. I believe that came from Jackie from Intera. The disability either came from Pam or myself because those were all customized and we sent them to your individual retirement account or email account, excuse me. And the retirement 401k is all online enrollment that myself and Brad will all be reaching out. We're going to schedule times that we can get you enrolled. And Jackie sent out the listing of the returns and everything of all the individual options and the money manager options. Did that answer your question?
Yeah, I just wanted to clarify. It's a lot of information.
Yes.
Thank you.
Thanks for asking, because there is a lot of information. And whatever you can do to help us help you get this all loaded, the sooner you can get that to Pam, the better, because then it's got to get uploaded manually into Paychecks for all of you, and then we can upload to the vendors. We will be circling back to everybody just to make sure we have healthcare as our ticket line, because we know everybody has to either sign up or sign off. But if you can help us not have to reach back out for the information, that would be greatly appreciated. Any other questions? I have none. Pam, do you have anything?
The only thing that I can say is if you would like to roll over your HSA monies, I do have a form for that. And also, if you're signing up for the HSA account through Healics now, I have a form for that as well. So if you'd like to transfer it and then also put in a new election deduction, I have forms for that. So I will actually have Jackie email those out to everybody again, or originally, so they weren't in your original packet. So I will have Jackie send those out as well.
Perfect.
I promise everybody next year it'll be a lot easier when it's just all online and you can just go on at your leisure and look at everything and click, click, click and be done.
And Pam, will there be a separate email or conversation regarding like internal benefits such as PTO?
We will be discussing that in the next few weeks or so, yes. Any other questions?
No, thank you.
Good.
If
Thanks,
you have
everybody.
any that you want sidebar individual, please email me or call me. I'm available. This is Cindy.
You.
All right.
Thanks,
Bye,
everybody, for your patience. Thank you.
Cindy. Well, I shouldn't have to feel like I gotta get diarrhea when I fill out this stuff, but I just